All right, Dr. Kimberly Wilson here, and I just wanted to make a brief video to talk a little bit about medically assisted conception. So here's my thoughts. I want you to consider for a moment with me what would be some reasons for not going immediately toward medically assisted conception. So things like IVF for sure, but also one of the very first things typically when you go to the infertility clinic, they're going to get some blood work. They might label you unexplained fertility. They might, they might have you go through a few cycles and let's just don't do anything, and then bring you back. And then, they give you the options to take things like Clomid or Letrozole, which are going to come in and sort of force your body to ovulate and become pregnant. And I want to talk a little bit why that maybe not your best idea to do that, at least at first, without giving your body a chance to heal itself and to prepare itself for a potential pregnancy. So one of the things that letrozole or Clomid does is it inhibits estrogen. And so that decreased estrogen will then, because of this feedback loop in your body where hormones respond to each other, what that's going to do is that's going to stimulate your FSH and your LH then to come in to produce more of that stuff, right? And to trigger an ovulation. And so that's a bit of a forced pregnancy. So what are you doing to your body that for whatever reason is deciding that it's not safe to become pregnant, and you're forcing it to? That's not probably the best scenario, which a lot of times that's why, we'll see miscarriages or maybe some complications with that pregnancy, or God forbid, but maybe some complications with the baby itself. So we got to be smarter about these things. So here's a few of the things that I like for you to consider. Number one, you're forcing your body to do something that's probably not ready to do. We don't know why, but we can go a long way in figuring out what that is. And you're also putting the responsibility of becoming pregnant into somebody else's hands, a stranger a lot of times, the fertility doctor, right? So now you're saying, okay, I'm just, whatever you tell me to do, it's in your hands. That's what we're going to do. And that can often, that can be stressful on a couple. I've seen it go as far as to decouple the couple because there's so much stress there when you're trying to force a pregnancy. It's not that hard to kind of, imagine that scenario where it just puts a lot of stress on the couple. So if we can go a long way in avoiding that, then yes, let's do that. So here's a few things I want you to consider. How do we get our body ready for a pregnancy before taking that leap into medically assisted stuff? Number one, nutrition. So it seems so simple, but man, if you're not giving your body what it needs, then it might be interpreting that as, oh, it's not a safe time for us to have a baby. So you got to think about your source of food, right? It's got to be clean. It's got to be organic as much as possible. I get it. Those things are hard, but clean up your diet. Think about your macros. Think about your micros. Are you eating enough protein? Are you eating too much carbs? Are you eating too much fast food? Are you eating inflammatory foods? Gotta think about these things. That's number one on the list, is nutrition. What about your blood sugars? You don't have to be a diabetic to be struggling with balancing your blood sugar. So you've got to be thinking about that. Stress levels can impact your glucose levels. And if you are stressed out, that's going to be difficult for your endocrine system then to balance estrogen, progesterone, FSH, LH, insulin, like all the things in that endocrine system can have this sort of trickle down effect if something on that sort of circle of endocrine is disrupted. I mean, it can be your thyroid levels, but any of those things can disrupt the entire circle, the entire endocrine circle. So you got to be thinking about those things. If you're not already moving, exercising in some fashion, then start. Meet your body where it's at. It can be very low level, things like a beginner's yoga, beginner's Pilates, just walking daily, whatever does it for you, but get your body moving and get your blood flowing and all those good things. Avoid putting in toxins to your body. So think, if you're a smoker, stop. If you're drinking, stop. If you're using recreational drugs, including THC, stop. If you are drinking a ton of caffeine, a ton of sodas, you gotta start limiting that stuff. So you gotta think about what you're putting into your body, and then you also have to think about what you're not putting into your body. So nutrient-dense eating, and get rid of all those toxins. You've gotta restore organ blood flow and movement. So think all the things within your abdominal cavity, your diaphragm, your intestines, your ovaries, your uterus, all those things. If they are stiff and stuck and not moving, then you're not getting the right kind of blood flow. The lymph system's kind of getting sluggish, and that is going to make for a very sleepy reproductive system. So you got to get that moving. That's where something like Mercier Therapy can be very beneficial. And if you're not sure if you need it or not, find out. Make an appointment for an assessment, get an evaluation from somebody who is a skilled professional, and figure that out. It's very important. Find out what your baseline hormone levels are. So that's going to be a day 3 blood draw in most cases. Ideally, it's between day 2 and day 4 of your cycle, but 3 is right down the middle. That's when your hormone levels are going to be at their lowest level, and it gives us a really good baseline. If there's some outliers at that baseline, we're going to be able to pick that up and go in and potentially tweak that and get you back to balance. So having that good foundation for potential pregnancy is gonna be such a better scenario. And even if you then, don't become pregnant on your own for some reason, and you end up needing that medical assistance, whether it be medication or IVF, then I'm not against that. But, if you do that without preparing your body to house a baby, to make a baby, to conceive a baby, then all those other things can be potentially harmful, and certainly can potentially be unsuccessful. And if you do your research, IVF doesn't guarantee a healthy pregnancy. It doesn't guarantee a live birth. I mean, there's some risk there. So you've got to do the work, and you've got to prepare your body, create a healthy environment, especially if you have a desire for multiple children. So do the work, do the hard work, and set yourself up for success. It's going to make you feel more empowered. It's going to make you feel more in control of your body. You're going to be more connected to your body. You're going to feel so much more authentic, and so much more qualified to handle whatever that fertility journey throws at you. So there's so much more I could say, but I did want to hit those sort of top or key points and give you some things to consider before jumping right into, oh my gosh, I got to make that appointment with the fertility clinic and see what that fertility doctor says I have to do, because I don't know. And all I'm saying is that some of these things are well within your control to make those changes. And you can really learn a lot about your body. You can learn a lot about your own cycles and your own hormones, and then just have so much more control over how you feel. And yeah, I just wish that this message could go out to a lot of people, because there really is a lot that you can do for yourself. And I think as females and as moms and as daughters and as educators and professionals, we should be screaming this a lot louder. Even if you need that medical intervention, please establish a strong foundation first. Okay, hopefully that gets your wheels turning. That gives you some thoughts to ponder, and I hope it gets you doing your own research and really looking into some of these things. I welcome any feedback, any questions, any conversation around this topic, and I actually hope that happens. And if you haven't already done so, please subscribe to this channel, and send this video to anybody that you feel like could benefit from some of this information. And let's be an advocate for change and for empowering women to take control over their own bodies, to take control over their own fertility without medication and some of these harsh interventions. All right, thanks for listening, and thanks for watching to the end. And please share this information to anybody that you think might benefit. I will talk to you next time.